You're watching News 3 HD at noon.
When someone is diagnosed with a devastating disease like cancer, any possible way to make them more comfortable and relaxed can help. That is one of the big reasons holistic treatments like massage and chiropractics are becoming common for patients undergoing traditional medical treatments. And joining us this morning is massage therapist Shelley Ferguson, along with Shannon and Jim Haddock, whose daughter Kari is undergoing some holistic treatment as she battles brain cancer. Thanks for being with us today. Shelley, let's start with you. What kinds of things are we talking about here? What kind of treatments?
What I do with Kari is relaxation massage, and definitely my focus is having the best intentions during that session, starting off with just centering myself, having the intention that she gets exactly what she needs during that session, and just kind of seeing what happens, keeping her comfortable. I communicate with her a lot during the session if I do something different, just to make sure that she's okay with that, because I really want to respect that she feels safe in that environment. That's really something I want to keep on top of with a 9-year-old going through what she's going through.
And Kari is 9 years old. This isn't a treatment, it's just sort of to ease symptoms.
Yep.
Why did you guys decide? Well, first back up, tell us the story here.
Kari was diagnosed with DIPG, diffuse intrinsic pontine glioma, on August 10th. When you get that kind of diagnosis, you're terrified as a parent, and we met with the team of doctors, and the only treatment mainstream that they could offer us is radiation. There's 6 weeks radiation. There's usually a couple-month honeymoon period where you feel great, and then it actually can progress the tumor pretty rapidly, which it already is an aggressive tumor. And then we decided to look elsewhere. As parents, we weren't willing to take that as a acceptance. And so we reached out to other DIPG families who are facing this and looking at what they've done to survive the diagnosis and to have 4 to 5 years under their belt of a very healthy, a good quality of life.
Yeah. And this had to be a tough decision, though.
Very difficult, because you're turning your back on the mainstream of healthcare. So it's more going back to basics and eating organic foods and back to the way that we were intended to eat. A lot of that, try and get away from chemicals and pesticides, and to bring the body and healing itself, inside before you are poisoning it more.
And does it seem to be working?
Yes. When we were going through the radiation, we actually did 13 out of the 30 treatments, and she was pretty depressed and lying in bed, and we couldn't get her up. She didn't want to be with her friends. And normally she would be the one where we had to bring her inside and force her to come inside. Now that we're off a couple weeks of the traditional steroid treatments and doing more natural supplements, she is out running around, riding her bike and riding her scooters, and laughing with her sisters.
Great news. There's a benefit for this coming Saturday. You're hoping to raise some money and just help with things, and it's a dinner at the Evangelical Lutheran Church in Mount Horeb. Tickets are $7 for adults, $5 for kids. There's also a silent auction with some great stuff, Chicago package, signed baseball, all sorts of good things. So it's this Saturday at 9:00 a.m. during the Mount Horeb Fall Heritage Festival. That's when it starts. Good luck.
Thank you.
Thank you so much.
Thanks for being with us today.
Thanks for having us.
We'll be right back.